Hello and welcome to this month's Health, Aging, and Disabilities Committee meeting. My name is Trip Congo. Just before we get started, just wanted to announce that today we're going to have a presentation by the Wilmington Health Planning Council to discuss Healthy Wilmington 2020. And I'll just let everyone introduce themselves, starting with my right.
Good afternoon. My name is Laveda Owens-White. I am currently the chair of the Wilmington Health Planning Council for 2012, and I'm glad to be with you today.
Kevin Kelly, City Council.
Norman Griffiths, City Council.
Margaret Sejo, Council Staff.
Gene Bradley, City Auditor.
All right, I want to thank everyone for joining us. And thank you, Mr. White. You can go ahead and let us know what's going on.
Absolutely. I would just wanted to reach out to the city, the health planning and aging disability, because there has been a disconnect between our councils, and I wanted this year to make that really that connection, to close that gap in that communication. The Wilmington Health Planning Council has been in existence since 1999. We started out with the task force with the Public Health Foundation, and it was our aim then to make Wilmington one of the 3 benchmark cities for health. And so that Wilmington not only would be a place to be somebody, but would be a healthy place to be somebody. So that's been my personal goal as a faith community nurse in the city. I have been mostly in the 19802 zip code area in my service. However, that has been expanded, and over the course of time, I think the city has adopted me as the faith community nurse. But this year with the Health Planning Council, we had started out in 2003 to develop a Healthy Wilmington 2010 Preventative Health Guide. And we did come up with the document in 2003. We had it published by the city. Our goals was to address the 7 issues that was most directly affecting our community, and that was access to health care and early detection, chronic disease, mental health services, substance abuse, violence, and teen pregnancy prevention, those 7 areas. And we came up with a tool that has goals and objectives to address these issues, and some developmental goals as well, that I don't want this document to sit on the shelf, but it should be utilized. And we've been promoting this document in the community to civic associations and any other groups that might be interested in the health of their communities. But we've been mostly trying to get it into the civic associations and planning councils to develop, to see what areas that they could address that most directly affected them, such as violence, or if they have a large number of seniors, to address chronic disease, and to do something about early detection and prevention along those lines. So once you do a community needs assessment and find out what's more prevalent in your neighborhood, those would be some activities that you would address. The Wilmington Health Planning Council consists of about 25 different agencies around the table. One being Christiana Care, the Public Health Department, American Heart Association, St. Francis Hospital. We have the major community-based agencies sitting around the table, and they all help us to provide our signature event of Wilmington Wellness Day, which we do each and every year. This year will be our 12th annual Wilmington Wellness Day. So in providing this for the community, we have updated that document. We did a white paper, and that was not published, but it is in the hands of the mayor. and we made some recommendations that we wanted to get started on. But I think we need your help. We think, I think that if all of us working together with some common goals, that we might be able to accomplish some of our mutual benefits, goals to our benefit. So that is why I'm here to acquaint you. Once again, I think perhaps when it first came out, the council did get some documents. I wanted to present before City Council as well, so that each one of our councilmanic district representatives would be aware of it and could help us promote it.
Okay.
And that is, I think we're starting, the first district just had a workshop on April the 14th in planning for our neighborhood. And the one thing that I wanted to stress is that health is not just the absence of the disease, but it takes a holistic approach, body, mind, and spirit, in order for our residents to benefit from the services that we're trying to provide. Does no good to have the streetscapes and all that in our neighborhood if no one is out there to enjoy it because they're concerned about safety issues. If they have to go out of our neighborhoods to malls because they're afraid to walk the streets, and that this document addresses some of the violence that I think we as a whole should be addressing, then that needs to happen. So I wanted to see how we could connect. I would like to see in what way we can engage and be a part of your goals and your mission so that we can help close the gaps that we are currently experiencing.
You mentioned Wilmington Wellness Day. When is that?
It will be the third Saturday in September, which I believe is the 19th.
Okay.
Rain or shine.
And where does that take place?
It will be at Rodney Square.
Okay.
And I would also,
15.
the 15th of September is the third Saturday, would be the, okay. So we're beginning to plan on that. And again, I will be asking for an appointment with City Council for some help.
Is that help in a formal way? I think it's like they're on dead presidents, green things. Yeah.
So I'd like to just know how this body committee works, so that I could take back to our council, so that we're currently planning for 2020, and see how we could adapt our white paper to accommodate your goals as well.
Okay. Yeah, we're definitely open and willing to help in any way that we can. So I look forward to that.
Thank you very much.
Definitely.
Yes, and we have a sorority in town, Chi Eta Phi nursing sorority, who our goal is service to humanity. So events where we could teach and do some screenings. We do the diabetes self-management program in trying to address these, but we need your help.
Okay. All right. Excuse me. Kevin, you had a question?
Thank you, Mr. Chair. I appreciate all the hard work you do. If you look around the city, we're an unhealthy city. I mean, we just have a lot of people who just don't take care of themselves, from children on up to adults. And it is a tremendous strain on all of us. We're not in the health business, the city, but we have to promote people, being healthy.
Yes.
And you're right, it's mind, body, spirit. It's a lot of different things that make you feel healthy.
Yes.
But the physical health of people really has to change, and especially our young people. I mean, they don't exercise, they play Xbox, they don't get out of the house, and all that leads to low self-esteem and a lot of different other factors that impact us. As well as people, our age. Trippy's still young too, and all of us are here, but people, need to, get out and exercise and do some things. Because if you look at the statistics, we have high AIDS rates, high heart attack rates,
Yes,
liver,
stroke,
obesity,
yes.
and things like that we have in the city that we've got to be able to address. And you're right about the crime. That's a big factor with making people feel better, you know, in their neighborhoods. But I like that. We were young looking back then normally.
Yeah.
12 years of Barkowski was on to bring back some memories of folks. But I think you always have to have a plan. But we also need to make sure that people know what their role is in the plan. What can I do to help
Absolutely.
get that together?
And this preventative guide is the plan. It's time to work the plan.
Right.
So that's why I'm here, because it has been, and I myself have promoted it with the neighborhood planning councils, but I think we need some official
Support, right?
support for the plan. And actually, Nemours is around the table of the Health Planning Council, and we're looking to utilize First Lady Michelle Obama's Let's Move plan to promote help reduce obesity in children. So we're looking to implement that and then spread it throughout the districts.
Do you have any partnerships with any of the schools, especially like the?
There is a plan. If you notice, if you could just open that up, the guide has for each sector, both public and private, we have health, the community, education, government, and business. For each, there's a role for each of us to play in promoting this document. And I think one of the things right now, there hasn't been that connection that I think we need in order to make this plan work. And so I'm here asking for help to help work the plan.
Yeah. I think one of the, I think one of the biggest problems you have with health, and I can probably speak for Black men, is that you don't think about it until you're really, really bad, you know, and you've really got some pain or some injury. My wife gets on me all the time about not going for regular checkups, and you know, seeing a doctor on a regular basis. You don't have to be falling out before you go see them, but a lot of us, you just don't do it, and then the next thing you know, something that could have been just a small thing becomes a big thing.
Haven't learned that an ounce of prevention is worth a pound of cure.
Right.
We keep promoting that.
But you know, the other thing too that's really, you know, I think, you know, really hurting folks is, you know, the cost of health care. More and more people are going without it because they just simply can't afford it. And you know, I think we're seeing the results of that you know, that there are only doctors in the emergency room, you know, and so of course that taxes resources to take a kid to the emergency room for a cold, but that's all they have, and that's what they have to do. And you know, I think, you know, we're seeing more and more other things that are happening, you know, and I'm talking now about mental stuff. You know?
Absolutely.
I mean, these veterans are coming back from these wars overseas, and you know, no telling what's going through their heads. I mean, we saw the gentleman up in the 1st District that took that woman, and you know, with the Hummer and all that stuff. And I mean, clearly, you know, there's you know, there's a need for preventive health, and for people to recognize the symptoms and say, hey, there's something wrong here. Got to take care of this.
And be willing to accept help and ask for help, especially when it comes to you know, mental.
Right.
I'm so glad you brought that up, because again, there's a plan for that. If we, in providing access to health care, more and more, and with the Affordable Care Act, there's going to be a lot of changes. And with those changes, people don't readily accept change easily. And one of the things that we can do is to educate our nurses in our congregations. Faith Community Nurses is an international movement where we're trying to promote nurses in health ministries, whether there's an RN there or not, in congregations, so that we can provide neighborhood wellness centers as opposed to disease and illness. And I think when you approach it from a wellness aspect, then you can, from the womb to the tomb, we can approach everyone and have them, through their faith organization, be more willing to accept things that the pastor might be promoting, just as you will be promoting good health practices as well.
Yes, Captain.
You brought up a good subject, wound care. I give the example, we don't have a wound care center in the city. You got to go to St. Francis or the emergency room and sit and pretend you're in one. I gave you one time, my son was in the schoolyard playing basketball in his skateboard shoes. He twisted his ankle. I had to take him to St. Francis because there was no like Glasgow Medical or something like that in the city. Didn't belong in the emergency room. And I get up there, there's a person who was bit by a cat,
Right.
another little kid that fell off a swing up the street from my house. We're all in the emergency room at St. Francis. We need a wound care center in the city. I know there was
I
talk
believe
about
Riverside still has its wound care.
Are they? Do they still have one?
I believe so.
Okay.
I hadn't heard that it's been moved.
Well, if not, I think we need to promote that more, because a lot of
Yes.
cuts and scrapes and bruises and things like that could be handled there than going to the emergency
Well,
room.
and Fairfax, they have a non-urgent care.
They're not
It's not in the city.
So if I'm in the city and I'm a mom
Yes.
and my kid's got a cut,
Yes.
I'm thinking I got to get to the emergency room
Yes.
instead of I need to get to the wound care center,
Okay.
because people in the county who are a little more educated and understand things a little bit, that's where they think to go first.
Okay.
And that drives up the cost of what goes on. I always feel we should have the same access as everybody else.
Well, Councilman Kelly, did you know that the Cathedral of St. John is looking at repurposing the cathedral since they're going to be closing in August? That'd be a perfect place.
And I could use your help with that. I mean, I'm fine. I think, that's something that, even if it was Christiana Care opened up something that was a little bit different, that would be helpful for us to be able to have, those type of things. Because I work for Health and Social Service Department.
Okay.
As I tell people, when you go into Walmart, 1 out of every 4 people in that line are on Medicaid. That's a lot of people in the state of Delaware. So we have a lot of people covered,
Yes.
with health insurance, but many go to the emergency room
Yes.
sometimes for that's where they
Yes.
think they need to
Yes.
go.
Right.
We've got to get away from it, especially
Yes.
people with kids who
Yes.
break legs, do different things that need to go,
Yes.
or sick or whatever it may be. But
Yes.
if that's something they want to do there at Cathedral, it's a perfect location for something like that. There's a lot of need there. But we'll see.
And the senior center has their geriatric
Right.
wellness program there too, so it would be a good fit.
Norman and I are
Just
getting
in case,
closer to that.
just in case it comes up in council.
Yeah, that's something. She's laying her groundwork. Her plan.
But just to pick up on something, what you did or still do, I don't know if you do it at Christ our King by taking blood pressure.
Absolutely.
That's the kind of thing. It's a simple
Absolutely.
thing. It's a small thing. It takes 5 minutes, but it reminds the person.
Yes.
No matter what you say, even if you say, "Hey, you got great blood pressure,"
Yes.
But here's something that's a medical procedure to take somebody's blood pressure, and it kind of gets them thinking. Okay, maybe I need to go get some other things checked. And the wellness thing you do on Rodney Square, where you check
Yes.
for body fat.
Yes.
And cholesterol
Yes.
and high blood pressure and all those other different things that you can literally go there and get checked out at Rodney Square. That's the thing, because I try to go every year.
That's great.
Yeah, but that
That's
shouldn't
great.
take the
Yeah.
place of me going to see a doctor.
No, that's true.
But
That's
it
true.
helps, yeah.
It gives you, sends up a red flag if there's
Yeah,
something
exactly.
wrong. With just the blood pressure screening, we have been able to save people's eyesights. We have been able to impact impending strokes by just the blood pressure. We've sent
Right.
people directly to the emergency room from the church. I've been
Right.
going around with our diabetes self-management program through the state, and just for support of parish nursing, faith community nursing, and providing programs, have been able to detect conditions exactly like that.
Right.
And it's life-saving.
Right.
So you do have a team that will go to different organizations or churches?
Our
You do this kind of-
Tau Eta chapter of Chi Eta Phi is a nursing sorority.
Okay.
And we do screenings. The faith community nurse wouldn't do any herself directly in the congregation, but we provide the education. We would raise awareness of the National Health Observances of Healthy People 2020. So like next month would be Older Americans Month. It would be High Blood Pressure Education Month. All these things, all these programs are being implemented in congregations. We're teaching about nutrition and how to be prepared in case of a disaster, preparing our congregations in the event that there's an emergency in the neighborhood. people will be coming to our congregations looking for help. So is the congregation itself prepared to receive mass numbers of individuals? Thank you very much for the time that you've given me. I really appreciate this, and I look forward to God be the glory. But I appreciate your allowing me this time to be with you.
If someone is interested in maybe trying to get a few of these packets, can they call you?
I
What's
think
the contact
it
number
would
for you?
be Romaine Alexander to see
Oh, okay.
see if he has some.
Okay.
Or let's see, I was at the budget hearing yesterday downstairs, and I think you may have the capability to print out a couple of, a few
Okay.
of them through the city.
How can people who may be watching contact you?
Yeah, can you say your phone number so for the
Oh, yes. Area code 302-547-3227. At Christ our King, 762-4140, extension 101.
Okay. All right, well, again, thank you. Thank you for the information. We look forward to working with you.
I'm looking forward to it as well as the entire planning council. And anytime, we'd like to be able to bring you monthly things that we're doing and get on your newsletter so that we can exchange our minutes so that you'll know what we're doing and if there's any way that we can help.
Okay. All right, thank you.
And I will be contacting Marilyn.
Yes, that's fine.
Okay.
Thank you.
Thank you very much.
All right.
Thank you.
Thank you.
And again, if you missed any part of this meeting and you would like to try to get some information, you can call us at City Council at 576-2140, 576-2140. Or if you just want to be a part of our next meeting and be on the agenda, you can call and ask for Mary Bell. All right, thank you so much, and this concludes the meeting.
Thank you. Wow.